All right, so um, let's look at this mind map about the principles of toxicology. Let's try and brainstorm and bring up everything that we know about toxicology. So, toxicology is basically the study of adverse effects of xenobiotics on living organisms. So, the modern toxicology actually goes beyond just the study of adverse effects of exogenous agents to even the study of the molecular biology of using toxicants as tools. Yeah, so I hope you know the differences between the toxicants and just the toxins. Toxicants more of man-made, toxins naturally occurring. Currently, many toxicologists study the mechanisms of endogenous compounds, such as oxygen radicals, like the free radicals, and other reactive intermediates generated from xenobiotics and endobiotics also. For example, apart from what is being received outside the toxicants, you can think of like uric acids from the pathway hyperxanthine xanthine to uric acid protein synthesis, gouts forming from excess accumulation of uric acid in the joints too. Yeah, so toxicology is a very broad field, not under pharmacology necessarily, though related to a whole field on its own. Okay, so the clinician must evaluate the possibility that a patient's signs and symptoms may be caused um, by toxic chemicals present in the environment or administered as therapeutic agents. So many adverse effects of drugs mimic symptoms of disease. So appreciation of the principles of toxicology is necessary for the recognition and management of such clinical problems. And toxicology, like medicine, is both a science and an art. So science of toxicology, um, with observational and data gathering phase, and the art of toxicology, to do with utilization of data to predict outcomes of exposure in humans and also animal populations. So in most cases, these phases are linked because the facts generated by the science of toxicology are used to develop extrapolations and hypotheses to explain the adverse effects of chemical agents in situations where there is little or no information. Right. So one thing that you have to also remember about toxicology, the observation, the fact that you introduce something in an organism and it causes a particular effect, maybe in rats, doesn't mean that the same thing will happen in humans. For example, let's say the administration of this particular drug, TCDD. I hope you know that drug, the 2378 tetrachlorodi benzopyridioxine to female sprague dolly rats. It induces hepatocellular carcinoma in that, but the conclusion that it will also have a similar effect in humans is unclear, whether it's a prediction or hypothesis. Okay, so that's one thing that you should be mindful of. That it's toxic in one species doesn't mean it's the same for another species. So there are several divisions when it comes to toxicology: the descriptive, risk assessment, mechanistic, regulatory, and informational. All these come into play when I think about the divisions of toxicology. So descriptive toxicology involves the undertaking of experiments or test procedures to provide standard toxicological data for the assessment of the safety of a chemical and it includes various protocols from acute to chronic toxicity testing, and the outcome is the is that data from this describes the toxicity of that chemical under the test. And mechanistic toxicology involves identifying and understanding cellular, biochemical, molecular mechanisms by which chemicals exert toxic effects on living organisms. Mechanistic data can be very helpful in demonstrating that an adverse outcome, for example, cancer death effects observed in laboratory animals, is directly relevant to humans. For example, the relative toxic potential of organophosphates insecticides in humans, rodents, and insects can be accurately predicted using an understanding of common mechanisms like inhibition of acetylcholinesterase and differences in biotransformation for these insecticides among the different species. So this malathion, for malathion, detoxification is more rapid in humans than in insects. One thing that you have to be aware of is that the propensity of a drug like saccharin to cause bladder cancer in rats may not be relevant to humans at normal dietary intake rates. That is for mechanistic data. They may be very useful in identifying adverse responses in experimental animals, but may not be relevant to humans. Mechanistic data too are very helpful in the design and production of safer alternative chemicals and in rational therapy for chemical poisoning and treatment of disease. For example, thalidomide, which was originally marketed in Europe and Asia as a sedative agent for pregnant women, was banned for clinical use in 1962, thereabouts, because of its devastating teratogenic effects in neonates, the birth defects that occurred if a drug was ingested during the critical period in pregnancy. But get to know that these immunosomes, it was just one type of immunosome of the thalidomide which caused this teratogenic effect, but the other was quite effective sedative. And mechanistic data actually helps to still go ahead and they use this medication in maybe cancer research, and it's actually being used. So that's for mechanistic data. The risk assessment toxicology, it involves review of the results of descriptive and mechanistic studies combined with study of potential exposures to make probabilistic estimations of risk in exposed populations, and it provides for a better understanding of the impact of toxic materials on exposed populations. Alright, so informational toxicology, it involves the collection, collation, and dissemination of toxicological information, and it includes some interpretation and summarization of data as seen in the provision of material safety data sheets for chemicals. And it's very crucial that those involved in this area have adequate background in toxicology, so that their efforts are not just thwarted by misinterpretation of often complex material. Okay. Regulatory toxicology involves evaluation of the available data. So for an agent and decision making about its application, and a clear example of this is the setting of workplace exposure standards. And the final decision may often be based on factors in addition to toxicological information. Alright, so in the interconnections, know that risks assessment cuts across everything, whether mechanistic toxicology, regulatory, or descriptive toxicology. And mechanistic toxicology also cuts across all. So regulatory, risk assessment, and descriptive toxicology is one thing that I should remember. Also, a recall from these mind maps. And classification of toxic agents. Toxin generally refers to toxic substances that are produced by biological systems such as plants, animals, fungi, or bacteria, like Xarella known produced by mold. And all these toxins, botulinum toxin, Clostridium tetani, tetanus plasmids, they are all toxins. Of course, they are from a natural origin, biological system, but toxicant refers to toxic substances that are produced by or are byproducts of anthropogenic activities. Anthropogenic, these are just man-made activities, artificial. So dioxin, the one we talked about earlier on, 2,3,7,8 tetrachlorodibenzoparadioxin. It's produced during the production or combustion of certain chlorinated organic chemicals, and some toxicants can be produced by both the natural and anthropogenic activities. So toxic agents may also be classified in terms of their physical state, chemical stability or reactivity, the general chemical structure, and poisoning potential. So with the physical states, whether it's gas, dust, liquid, chemical stability and reactivity, explosives, inflammable, oxidizer. And then when it comes to the general chemical structure, I take into consideration like a drug with an aromatic amine or halogenated hydrocarbon. And also when it comes to poison potential, we can subclassify them into extremely toxic, very toxic, and slightly toxic. So classification of toxic agents is based on their biochemical mechanisms of action. For example, alkylating agents, cholinesterase inhibitor, methylglobin producer, and it's usually more informative than just the classification of general terms such as irritants and corrosives. Okay. So just a recap of the other terms that we mentioned. Okay, so toxicity is the intrinsic property of an agent to adversely affect an organism, and a hazard is a potential for the toxicity of an agent to be realized in particular situation, and risk is the probability that a hazard will be realized, and safety is the probability that a hazard will not be realized. Okay. With toxicokinetics, it's quite simple. It has this relation with that of the pharmacokinetics, the ADME, absorption, distribution, metabolism, excretion. So once a living organism has been exposed to a toxicant, the compound must get into the body and to its target site in an active form to cause an adverse effect. So the body has defenses, as membrane barriers, like passive facilitated diffusion, active transport, and also biotransformation enzymes, antioxidants, elimination mechanisms. So for absorption, still on the toxicokinetics, the ability of a chemical to enter into blood. Yeah, so blood is in equilibrium with the tissues too, so remember. and various routes to has its own absorption rates. So inhalation, ingestion, and thermal. For inhalation, readily absorbed gases into the bloodstream via the alveoli occurs, and large alveolar surfaces, high blood flow, and also proximity to blood, of the blood to the alveolar air increases the absorption. For ingestion, the first pass effects and the rest. So absorption through the GIT wall, stomach acid, intestines, lung contraction time, could affect absorption. And the last surface area, bases and transporters for others, first pass effect, all these affect absorption. And dermal routes for that one to, through the epidermis, the stratum corneum, and then the dermis site, and also the size and the condition of the skin too will affect absorption. Okay. So when it comes to distribution, well, this the process by which a chemical agent translocates throughout the body. Yeah, so from circulation to the site of action. So the blood carries the agent to and from its site of action, storage, depot, organs of transportation, and organs of elimination. So the rate of distribution, whether rapid, depends upon the blood flow and the characteristics of the toxicant. So its affinity for the tissue and the partition coefficient. So distribution may change over time, and storage in adipose tissues. Very lipophilic compounds like DDT will store in fat, and rapid or rapid mobilization of the fats, that is during states like starvation, can rapidly increase drug concentration. And with the storage in bones, chemicals analogous to calcium, fluoride, lead, strontium, and the binding of plasma proteins can displace endogenous compounds. Only free toxicants is available for adverse effects or excretion. Okay, so absorption, distribution. So, and still on distribution, the target organs, the adverse effect is dependent upon the concentration of the active compound at the target site for enough time, and not all organs are affected equally. So, greater susceptibility of the target organ and then higher concentration of targets of active compound to plays a very important role. So, bone marrow, intestinal mucosa, there's rapid division, and its effects, the toxicants effects on this bone marrow will be different from that of the lungs, which also has high blood flow, and site of exposure to is large. And with the kidney too, it also has high blood flow concentration, concentrates chemicals to, and the liver to high blood flow, oxidative reactions, and several other things too. Okay. And with neurons, oxygen dependent, and usually damage is irreversible, and myocardium is also oxygen dependent too. Yeah, so the target organ and the type of toxicants, the greater susceptibility of the target organ to that particular toxicant, the more the issue can occur, or more toxic effects can be seen. Okay, so lastly on drug distribution, still on the target site, the adverse effects can occur at the level of whether the organism, the organ, cells, molecules, or even atoms. So molecular sites, the chemical can interact with other proteins, lipids, DNA, and cellularly, the chemicals can interfere with receptor binding, ligand binding, and also interfere with membrane function and with cellular energy production, binds to biomolecules, and perturb homeostasis too. they can really perturb or disturb calcium homeostasis. Now with metabolism, the adverse effect depends on the concentration of the active compound at the site over a period of time. So the process by which the administered chemical as a parent compound are modified by the organism by enzymatic reactions is referred to as metabolism in toxicology. Yeah, so the primary objective is to make the chemical agents more water soluble and easy to excrete. So decrease in lipid solubility, decrease in amount at target sites, and increase in ionization increases excretion rates, thereby decreasing toxicity. So bioactivation, the biotransformation can result in the formation of reactive metabolites and can drastically affect the rate of clearance of compounds. It can occur at any point during the compound's journey from absorption to excretion. Alright, so let's take some examples like ethanol. So without metabolism, it takes 4 weeks, but with metabolism, it takes just 10 mils per hour for it to be eliminated. So let's do some calculation. If let's say 100 mils of ethanol per hour, 100 mils of ethanol, not per hour, but it's, if you are using the calculation, then it's more of just within 10 hours you've eliminated this. That's with metabolism. Without metabolism, we are dealing with hundreds of hours, yeah, and that makes it very toxic. And another drug like phenobarbital, it takes 8 hours with metabolism to be moved or excreted, but without metabolism it's like 5 months with so much. DDT is actually infinity, but with metabolism it takes days to weeks for it to be eliminated. So biotransformation pathways, that one we already know the phase 1, phase 2 reactions. Phase 1 makes the toxicant more water soluble, and phase 2 links with a soluble endogenous agent as conjugation. So the key organs in biotransformation, the liver, lungs, intestines, and others. So the liver is very high, biotransformation is very high over there, and liver, kidneys, intestines is medium, others are quite low too. Okay, let's move on to excretion. So with excretion, it's simple. Whether urinary excretion, exhalation, and biliary excretion, whether through the mammary glands or even sweat glands. So with urinary excretions, water-soluble products are filtered out of the blood by the kidney and excreted into the urine. And with the exhalation, volatile compounds are exhaled by breathing. But with biliary excretion, via fecal excretion, the compounds can be extracted by the liver and excreted into the bowel, and the bowel drains into the small intestines and is eliminated in the feces. So milk, sweat glands, too could be menstruates, they can be eliminated.